Good afternoon, everyone, and thank you for joining me today. This is our third interview in the new Membership Spotlight series that the Maryland Chamber of Commerce launched in light of the COVID-19 pandemic. My name is Whitney Harmel, and I am the Vice President of Membership and Development for the Maryland Chamber of Commerce and the Maryland Chamber Foundation. I am so pleased today to be speaking with Elizabeth Liz Porter from Leidos. Liz is the acting president of Leidos Health Group, where she leads an organization of several thousand employees providing services and solutions in everything from health information technology, population health risk management, health analytics, life sciences, and of course, the topic that's bringing all of us together today, which is public health. Liz, thank you very much for spending this time with me today. Can you share a little bit more about yourself and about Leidos?
Well, thank you very much for having me, Whitney. I'm happy to be joining you this afternoon. Certainly, Leidos is a global science and technology solutions company that focuses on working to make the world safer, healthier, and more efficient. And when I think about what that means, I think about harnessing the 36,000 employees we have to solve the toughest problems for our government and commercial customers around the world. And when I reflect on the fact that I've been with Leidos for about 25 years now, most recently within our civil group, it is a really exciting time to take over the health group. I am a military spouse. My husband's active duty military, and I'm a user of the TRICARE system. And when I think about the fact that we support the Defense Health Agency, Veterans Affairs, and other organizations such as that, it's very fulfilling to know that not only am I a user, I now provide support to myself and people like my husband. If I think about the health group in general, I think about the fact that we really are looking to revolutionize the future of healthcare, not just for hospitals and health systems and biomedical systems, but also for other U.S. federal agencies that are focused on health. Many of those federal health customers are actually in Maryland, whether it's NIH, CMS, SSA, FDA, and even the Frederick National Laboratory for Cancer Research. There's a lot of great customers that we serve, and very happy to be talking to you about what we do across the world, but specifically in Maryland.
Well, we're very happy to have you. I have always known Leidos to be a leader in the community, and there are a lot of ways that you guys are leading in some major initiatives. One of them is something near and dear to the Chamber of Commerce's CEO, Christine Ross. She actually signed your CEO pledge to end opioid addiction. I know that this is an initiative by your CEO, Roger Crone. I would love if you would talk a little bit more about this pledge and about some of the other initiatives for Leidos in the community.
Thank you. You know, Leidos does believe in taking care of the communities where we live and work. You know, it is something that we are members of the community, as well as individuals that have companies in that area. And so raising awareness about the opioid epidemic is one of the causes we are incredibly passionate about. Since about 2017, Leidos has placed a very strong emphasis in Maryland with that ongoing opioid campaign. Some may be aware of the fact that we distributed more than 100,000 drug deactivation kits in conjunction with the Maryland National Guard. And just this past NFL season, when I think about sports, it's kind of exciting to think about sports since there aren't any right now, but last season we did partner with the Baltimore Ravens as part of their Tackling the Opioid Addiction initiative. And this is something that we will continue to be involved in, and we want to be a role model for companies in this area. Other ways that we work within the community, most recently, specifically with the pandemic on our minds, we have partnered with the U.S. Centers for Disease Control and Prevention, the CDC. They have a foundation and donating to the emergency response fund that's called All of Us. It's a campaign. And as part of that effort, Leidos will be matching up to $1 million in employee donations, specifically focused on supporting the communities and how they address the virus, and looking at various ways it can increase lab capacity for testing and research and other things the CDC is doing.
Now, is that through 2020, Liz? What's the time frame for that?
Right now, it was something we just initiated, so it will be obviously until we reach our goal, I'm assuming, but that was something we just initiated this year.
Okay, great. And on the screen right now, for all those that are watching, we have the website, and I would really encourage people to go to leidos.com/CEO pledge to consider signing this pledge to end the opioid addiction in our workplaces. And this is something, as I've said, our CEO is very passionate about. And I would just encourage not just Maryland businesses, but any business that's listening in to take the lead of Roger Crone and the team at Leidos. Watch the video, read through it, and consider signing it and being a part of the fight against opioid addiction. So thank you for outlining that, Liz. I really appreciate it. Let's switch gears a little bit and go into why we're here. And that's to talk about COVID-19. Leidos is leading the way in a couple of different areas. I would really hope that you have a few minutes to outline what Leidos is doing to fight COVID-19 in a couple of different areas: health, of course, defense, civil, and intelligence. If you can touch on all of those, Liz, I'd really appreciate it.
Certainly. When you think about it, along with everyone else, we are very closely monitoring the situation and looking at the guidance that we're receiving from public authorities. We are using that and leveraging that to help update the guidance that we have and providing that out to all of our employees. Safeguarding the health and well-being of our employees is one of our top priorities. But when I think about the fact that it's an unprecedented time, and it really does require a robust and far-reaching response, we are actually somewhat uniquely positioned as a major government service provider in having the knowledge and capabilities to work with our customers, whether that's in defense, civil, intel, or health. We really are partnering with these customers to adopt various capabilities that we have to the circumstances. There are some areas within the defense arena specifically, and actually across all the customers, where we're looking at helping them expand their telecommuting capabilities, their ability to work virtually, whether it's our employees or their employees. We have a couple of activities that we've supported in that area. And then when I look at specifically in the health arena, we actually have been doing this for a while. This is not new to us, some of the support that we're giving, but now we're pivoting it towards this pandemic. So we have provided modeling analysis support to HHS related to preparedness responses. We've been doing that since 2006, actually. We actually worked with the CDC on data collection and reporting of some of the test results during the initial waves of the pandemic. For many years now, we've supported the strategic national stockpile and the logistics associated with it. And we are continuing to explore and look at how we can take the work we've done in antiviral therapeutics, as well as in antibody production and immune response, and use that to try to help in this fight. Additionally, we're working with go ahead.
No, I was going to say, it sounds like your partnerships run really deep and have been long-standing relationships that you have across all of these sectors.
Absolutely. One of the areas that we've worked in specifically is related to telehealth, and it's something that we've been able to partner with our customers to expand that use. And that is something we're actually seeing both, not just in the health arena. We've been doing things for Veterans Affairs and for Defense Health Agency, and looking at how we can expand that to some of our commercial endeavors with some of the other healthcare institutes across the country.
Excellent. You had mentioned that you have 36,000 employees, and I would imagine that this is on the mind of all of them, and in some way, form, or fashion, almost all of your employees are probably touching the fight against COVID in some way, form, or fashion. I have known of Leidos for years. I have had direct contact with multiple people in your organization during my time, my 2.5 years at the Maryland Chamber. One thing I have always known about your organization is how much you value your people, how much you value your team. Can you tell our audience how Leidos is handling your workforce in the midst of COVID-19?
Our employees are incredibly important to us and to the business. We actually have a very mobile and virtual workforce. So this is a time where they're able to leverage that capability, but with that, it also stresses the need for us to be able to communicate with them and to share with them what we're doing and how we're taking care of them. Our CEO, Roger Crone, actually encouraged all of our employees to leverage the teleworking options, and we expanded our teleworking options to enable everyone to follow the guidance of the various states that they're working in. And we are actually setting new records for our virtual private network connectivity at this time, and it's been very, very successful. But we really want to also make sure that we were meeting our customers' missions. And so we've really talked closely with both our employees and our customers to not only enable the teleworking, but flexible schedules and look at ways that we can help encourage and provide guidance to follow the CDC guidelines, whether it's social distancing or wearing the facial coverings. And that is something we are continuing to update as new information comes out and trying to lead the way for both our employees and our customers. To that end, we've been looking for various ways to communicate. We all know that email is not always something everyone can get to, so we've been utilizing several video taped messages that either come from the CEO, or they also from the CEO and several of our senior leaders to provide what are we doing, how we're helping them, that we're in this with them together, and that they can see us in our home. That's actually one of the things that's kind of exciting is we're all getting to see everybody's home because they're part of the videos. But really, helping to communicate that on a continuous basis so that our employees know that we're there for them.
Yeah, I think I was telling my team, we all just need to have grace with one another, that everything that we knew 4 to 6 weeks ago has shifted. And I can't imagine, Liz, doing it with 36,000 employees. It sounds like one heck of a job you and your leadership team have had. So bravo. I will say that you guys are doing an outstanding job keeping people informed, and there are lots of resources. You have a very robust website, and I'd like to just point people to continue to follow what you're doing. I think as the weeks and months transpire, Leidos will have a lot more to share in your efforts with this COVID-19 pandemic. So I'd encourage people to check out leidos.com / COVID-19. You all also have multiple social media channels that people can follow, not only to stay up to date on what's happening through this COVID crisis, but also in general, what Leidos is working on and the good work that your entire organization is doing. So I would encourage our listeners to continue to follow you. Liz, before we completely wrap up, I wanted to get your final thoughts regarding COVID-19, anything that you would like to share to our listeners about Leidos and your response?
Absolutely. I mentioned earlier that Leidos' mission is to make the world safer, healthier, and more efficient. And one of the things I want to leave you with is that, we really are partnered with both our customers and our community to look at how we can respond to this global pandemic. And, it's something we look forward to trying to make an impact in.
Absolutely. And I do have one final question for you, but before I do, I went on the website and saw Roger Crone's video statement that he made, and it really struck me. And I wanted to share it with everyone listening or watching today because I think it really speaks to the culture of your organization. And so I'm just going to take a moment to read through that with everyone. It says, "It's often in these challenging times that we see the best of humanity and of each other. I believe this is an opportunity for us to be better at our own technology, better at working remotely, better at being agile, better at communication, better at including the thoughts of all of our team, better at taking care of each other. He went on to say, this also gives us a chance to strengthen our bond between our people, our organization, our customer, our communities, a sense of togetherness and connectedness now more than ever, despite the walls and devices that separate us. I just think that was so beautifully stated by Roger. But I wanted to end today with your thoughts, Liz. And what positive thing do you think will come out of this crisis and all of this chaos?
Well, Roger obviously said it best, and you even mentioned, the terminology grace. I think that this crisis has given us time to remember what family and community really all are about, and how we are all very individualistic, whether it's individuals home with their children because they're homeschooling, or being home with your pets and having them bark while you're on a call. It really humanizes everyone, and that we will walk away from this remembering that individual and really embracing, when we talk about inclusion and thinking about people as humans, that we will remember this moment, and that will really carry through to our work every day.
Yeah, we'll be talking about this not for years, but for decades. I truly believe that. So, Liz, thank you very much for sharing how Leidos is leading the way through these exceptionally challenging times. And I can tell you that me and the Chamber, we are very grateful for you and your team and what you're doing. And we absolutely look forward to all the hard work that you're doing, having a positive ripple effect across our community. So thank you very much again for joining me.
Thank you very much for having me. Thanks, Whitney.
Yeah, and thank you to everyone listening. I will be bringing you another interview next week with a Maryland business who is leading the way through the COVID-19 crisis. And as always, I encourage you to continue to get up-to-date information and resources on the Maryland Chamber website. We are regularly posting updates for businesses and for residents, and I just encourage you to keep checking back. Have a great day, everyone. I am wishing you good health. Take care.